Hi, I'm Dr. Bhalja from Downtown Podiatry Physicians here on 80 Maiden Lane, and today we're going to talk a little bit about treatment options for bunion deformities. So if you want to backtrack a little bit and define what a bunion deformity is and how it arises, please refer to my last video, and you can check that out as well. So basically, in treating a bunion, what we need to first do is classify its severity. So with a clinical examination and x-rays, I'm able to kind of tell you if you have a bunion deformity that's mild, moderate, or severe. And depending on that, we can kind of tailor a treatment plan based on you and your lifestyle. So sometimes, people are afraid to seek treatment for this because they think, the first thing they're going to want to do is surgery. But there also are a lot of conservative options that we can start with. So the bunion itself, when you're looking at the bunion, you have a medial bump on the foot, on the great toe joint. But there's a lot of components in this area that can include a capsulitis or a bursitis, which basically means that there's inflammation around the soft tissues in that area, around the joint. There can also be an overgrowth of bone in this area that prevents you from kind of moving it and gives you a lot of pain. In all of these issues, basically we can treat you with, conservatively, with padding, strapping, custom orthotics, or injections into that area, which is pretty non-invasive. And sometimes we even use physical therapy to kind of retrain the way you're walking and the musculature in that area to control the foot. Now, if we do find that your bunion deformity is moderate or severe and it's been going on for a long time and you're having pain, swelling, redness in that area that seems like it's not responding to those conservative treatments, then we can talk to you about surgery. Now, a lot of the surgical options can include something like just shaving the bump in that area, which is a pretty short recovery time. But there's also a lot of other things we can do, which include putting in a joint implant or using an arthroscopic technique to just clean up the joint in that area. We can also make a cut in that first metatarsal bone and actually shift it over and put some screws in, and that way it kind of keeps that deformity from coming back. We can also even fuse the joint in that area, which requires a little bit longer recovery, but it kind of depends on what your lifestyle is like and what you can spare. So in order to determine what would be best for you, it would be great if you made an appointment at downtownpodiatryphysicians.com today.